Sexual assault and childhood sexual abuse are two of the most traumatic things that anyone can live through. And it can have an overwhelming impact on someone's life and ability to enjoy life. But it doesn't mean that there's no hope in getting through the difficulty that it brings and the manifestations of trauma that it causes to a person's psyche and their day-to-day living. And one way that someone can really begin to feel like they're on a journey to address what happened to them and to help them get through those struggles is through finding therapy. Statistically, we know that the average child sexual abuse survivor usually doesn't disclose till 56 years old. And that disclosure may not even be to a loved one. And sometimes that disclosure may just be to a counselor because it's a person who doesn't know their employer, they don't know their family, and it's a place to really feel unburdened by experiences that may, although they shouldn't, but that may bring someone immense feelings of shame. Therapy is a place to really to be able to share, and given the confidentiality involved, they can feel like it's a safe space. And also a place where if they are going through litigation, that they can express the trauma that may go along with that and having to relive what happened to them. There are many different therapy techniques that survivors may benefit from, some of which involve learning how to deal with emotions when they come on. So if someone suffers a PTSD flashback when they're faced with a certain trigger, like a smell or a location or a sound, a therapist might be able to help them to figure out how to compartmentalize that experience and to address it in a way that enables them to get through that moment so that it doesn't take over. Also, just deep breathing techniques, group therapy to find that maybe they're feeling less alone, that there's other people who've been through the experience. It's really personal to the survivor and what feels best to them. But the most important thing is that they're in a place where they feel like they can share what happened and work on addressing ways to make their day-to-day life feel more manageable.